Our Emergency Medical Technician program is 5 classes, 3 EMT classes, medical terminology, and technical communications. Students participate in hands-on learning in our EMT simulation lab on campus and ride on ambulances to get exposure in the field with a variety of patients, from those involved in motor vehicle accidents and other traumas to house calls. Once certified, our graduates can work with any of the county 911 services or patient transportation services in the military and with fire rescue or medevac. Becoming an EMT is the first step to becoming a paramedic, and the need for both continues to grow.
Our one-year program teaches students how to greet patients and schedule appointments, assist in billing and coding, perform vitals, venipuncture, and capillary sticks, run blood and urine analysis, assist with medical examinations, and perform EKGs. Graduates of our program are also able to receive their phlebotomy technician certification. Each class has a lab component that gives students the hands-on experience needed to fully grasp the material. Our students also participate in off-site clinicals, offering them an opportunity to use the skills they've gained in our on-campus labs at local doctors' offices. Because their skills are so broad, there's a huge demand for medical assistants. Our graduates work in hospitals, medical offices, outpatient care centers, diagnostic laboratories, and nursing care facilities.
Our Patient Care Technician program trains multi-skilled health professionals. Students earn credentials in multiple employable areas. They start with Certified Nursing Assistant, where they learn basic patient care skills and are able to go work in a long-term care facility or at a hospital. Phlebotomy teaches basic blood drawing and venipuncture skills. Students get exposed to common lab procedures that happen in a doctor's office or at a hospital. For the third skills, students can choose between dialysis technician and electrocardiography or heart monitoring. The beauty of PCT is you can start there and go on into nursing or radiologic technology or any of the other healthcare programs that we offer. Graduates can work in any hospital or doctor's office, outpatient labs, long-term care facilities, and more. PCTs are in very high demand.
Our practical nursing program has 2 options, traditional and flex, which is for people who are already working in the healthcare field with some type of certificate. Both options are 3 semesters with on-campus lectures and activities in our skills and simulation labs and on-site clinicals in local nursing homes and the regional medical center. Students take our Fundamentals of Nursing and Drug Calculations course, 2 med-surg courses, pharmacology, pediatric, maternal newborn, and leadership gerontology before preparing for state boards, where you obtain your license to practice as an LPN. Flex students only come to campus 2 days a week, 1 day for lecture and tests, and the other for clinicals. Licensed practical nurses can work in hospitals, long-term care facilities, home health, and doctor's offices. There are all kinds of opportunities for LPNs. And practical nursing provides a nice introduction to nursing for those who might not be sure they actually want to work as a nurse. It gives them the opportunity to come back and earn their associate degree through our flex and transition programs. It's a quick way to get a job as a nurse and then further your degree. Nurses will never collect unemployment. There will always be a job for you somewhere. Our associate degree nursing program leads students to a career as a registered nurse. We have 3 tracks available to students. The traditional program is 5 semesters, while our transition and flex options offer licensed practical nurses a faster track to earn their ADN. This is an intense program that requires a lot of dedicated study time. All of our ADN students participate in a variety of clinical settings, from the operating room to psychiatric rotations in our local hospitals in Orangeburg and Columbia. When they're on campus, they're practicing in our 29-bed skills lab or our 8-bed simulation lab. The state-of-the-art sim lab has a pediatric and adult mannequin where students can practice real-life scenarios. It's like you're actually in there with the patient.
Who are you?
We even have a maternal newborn simulation where students can deliver babies and do newborn assessments. This lab provides a safe environment for students to learn, ask questions, and make mistakes. What you learn on day one, you're going to have to know until death do you part. And learning will never stop. Students apply up to 6 months before our nursing programs begin and must attend a health information session, or better known as HIP, to get the application. Graduates can work in acute care, critical care, surgery, home health, long-term care. Basically, registered nurses can work anywhere. The job opportunities are limitless and you will always have a job.
We prepare our students at OC Tech to be good clinicians by doing a lot of lecture, and then after lecture we immediately bring the students into a lab session where they work with their classmates. They get immediate feedback from faculty. They do a lot of hands-on experiences where they just practice clinical scenarios that they will likely see once they're ready for clinic. We have 2 7-week clinical rotations where students actually go out in the field. They may go to a hospital or a skilled nursing facility or an outpatient setting, and they get to treat real patients under the direction of a physical therapist or a physical therapist assistant. Upon graduation, students have a wonderful opportunity awaiting them in the job market. So settings include things like working in a hospital. They can work with pediatrics in a school system or even in pediatric private clinics. They can work in skilled nursing homes, inpatient rehab, outpatients. They can work in industrial settings. They can do wound care. So just such a wide variety of options upon graduation for job opportunities. The demand for physical therapist assistants right now is really, really high. There's a 29% growth opportunity expected over the next 10 years in this profession. And so students have a wonderful opportunity to graduate and immediately find a job. In fact, several of our students have been offered jobs while still on clinical rotation.
Our 2-year competitive entry rad tech program is intense. Students should come in with good study and time management skills, as well as a strong background in math, biology, anatomy, computers, and medical terminology. Radiologic technologists work in a fast-paced environment with a variety of patients who have health issues and are seeking answers. Because radiology gives us the ability to see inside the body, it provides necessary information to help diagnose medical problems. Our innovative faculty empower our students for success and work to transform them into efficient healthcare workers. Our on-campus lab gives students hands-on experience with equipment that they'll actually use in the field. This gives them an edge in their clinical rotations. Courses build on each other, so what our students learn during the first semester is used through their last semester. Students rotate through clinical sites at our outpatient ambulatory centers, hospitals, and orthopedic offices in Orangeburg, Columbia, and Manning. Graduates work in hospitals and outpatient imaging centers, physicians' offices, orthopedic offices, and mobile imaging units. They can even become a traveling radiologic technologist, which is a great way to see the country. Graduates further their education with CT, MRI, radiation therapy, nuclear medicine, special procedures, or ultrasound. There are a lot of opportunities to move forward in the field, and we work with our graduates to help steer them into whatever direction they want to go. There will always be a need for radiology and radiologic technologists. You've just got to be dedicated and determined to succeed.